Hello and welcome to this edition of the Urban Debate. We continue with our special mental health series that we restarted as the second wave of pandemic hit us, and every week we've taken one aspect to talk about it, and I continue with that tonight. I want to start off with a small story, something that I found out earlier this week. A lady here in the city of Mumbai and her 7-year-old jumped off the balcony and died by suicide earlier this week in the city of Mumbai. She lost her husband and in-laws to COVID recently. They were not even in the same town. And because of the pandemic, the second wave, we understand she couldn't even be there, couldn't get a good final, some kind of closure. And ever since she lost her husband, it was difficult for her to come to terms with that grief. Now, the letter she left behind mentioned several other reasons, and that is part of a police investigation now. But that instant shook up that entire locality. All her neighbors, that entire society, people like us who read up about it, maybe some of you also did read about it. A woman taking her 7-year-old along as she jumped off because she couldn't take the pain. This is very real, and this is not just the story of one family. In this pandemic, grief has just been magnified, intensified exponentially. The pandemic has made it worse because we can't communicate with outsiders. We are locked up. Sometimes we don't even get to say the final goodbye. We don't get closure. We can't share our grief with others around. The isolation just makes it worse. And so tonight, I want to talk about dealing with such grief. Dealing with the grief of losing a loved one. The loss, the trauma, the distress. How do we do that? And not just if you are somebody who's gone through it, but also if you're someone who knows a person who may be going through it. What can you do? What can you do locked up in your own home? If you're wondering, then let's talk about it. If you're someone who's not just going through grief, but also the survivor's guilt, if you're someone who's lost multiple family members or loved ones and now are ridden with guilt, with questions of whether you did enough, could you have done anything more? And if that is derailing everything else in your life, then let's talk about it. Let's listen to our experts and see how together we can make it easier for us. Dr. Manushree Gupta, Associate Professor for Department of Psychiatry, VMMC in Safdarjung Hospital, joins us this evening. Dr. Nimesh Desai, Psychiatrist and Psychotherapist, Director at ABAS. Dr. Amit Malik, Psychiatrist and Founder for Inner Hour. Dr. Santosh Chaturvedi, Consultant Psychiatrist, former Dean at Nimhans. Dr. Yashaswini Kamaraju, Child and Adolescent Psychiatrist and Director for the REACH Clinic, founder for the REACH Foundation of Community Services as well, joining us this evening. Good evening, and thank you to all of you for being with me. Let me actually start off with Dr. Malik on this. Dr. Malik, has there been a rise that you've noticed and come across, even in your work, of such cases, more cases of intense grief and people not knowing how to deal with it?
Good evening, and thank you for having me on. Absolutely right. So first thing to say is, as you mentioned, grief doesn't affect one person or a couple of people. Averagely, one person's grief affects up to 9 to 10 people, right? So one person's death can affect up to 9 to 10 person and leave 9 to 10 people and leave them grieving. right? So that's the first thing to say. And so, yes, I think we've all in our professional space been seeing multiple people who are dealing with multiple sort of such incidences in the last, especially after the second wave, right? And so we are seeing both at individual level, and we work with organizations. We've been working with managers to support them, support their employees who've been dealing with grief directly or indirectly. So so grief is both from a relationship, family perspective, but also colleagues, loved ones who are not directly family, right? So one death leads to multiple people falling into a grieving scenario, and we've been working with people both at individual and organizational level that have been experiencing large amount of grief, sometimes multiple incidents of grief, one after the other, right? Be it at home or in the workplace. And so, yeah, we've been seeing a lot more of that. And we've been working with a lot more individuals and organizations in the last sort of 2-3 months with specifically with grief from that perspective.
When people do reach out, what do they say? What is it that they are facing or going through? And I ask you this question, in the hope that some people who may be watching this, if they relate to it, then they know that they too could reach out for help.
What we've seen a lot of in the last couple of months is family members and friends reaching out and sort of connecting people to us to start getting help. Right? So and sometimes it's very difficult for the individual themselves to recognize or be in a place where they're actually seeking help themselves. So we've been seeing family members, colleagues, friends, sort of helping them connect to us and saying this person's obviously had multiple griefs or say a single sort of tragedy in their family, and can we help them and work with them? And when they do reach out, we see a range of symptoms, right? We see some people in shock and disbelief, some people in sadness, some people experiencing guilt, right? Some people feeling angry about the circumstances that led to such a death, and some people scared about what the future would look like. So we see people with a range of emotions that are reaching out to us, and then people are experiencing the symptoms as well, right? So some people are tired, not able to sleep, not experiencing aches and pains, nightmares, dreams, a range of symptoms people have been experiencing, and those are all, especially after a recent bereavement, those are all signs that it's time to sort of talk to somebody and get some help, because you might be grieving and need support through that journey, essentially.
Yes, in fact, Dr. Desai, if I can come to you, what is perhaps one of the reasons which is also making this a lot more difficult is that your usual, methods of closure aren't available to you. We have, especially in our country, we have a series of these rituals, meeting, being with people, being with family, the kind of things that we do, that we are tuned to for getting that closure is also not taking place. So, what kind of impact does that have further on a grieving or a mourning person? Okay, I'm going to go to Dr. Desai in just a bit. Let me take that point across to Dr. Manushree Gupta.
Yes, thank you, and good evening to your viewers as well. And what an important topic, what an apt topic to discuss in these difficult times. As we can all appreciate that COVID pandemic has ruptured our traditional notions of grief, bereavement, and how to process this loss. So what kind of patients that we are seeing these days has a lot to do with the nature of this pandemic. COVID pandemic or death due to this pandemic is actually a very violent or a bad death. People are not very confused. The society is confused. The doctors are kind of confused how to process this. So as you can appreciate, when a person dies due to coronavirus, he actually dies and usually dies in isolation without the support of their loved ones. And coronavirus has inflicted a lot of restrictions on our activities. So you rightly said that those processes of mourning and bereavement that are ingrained in our culture and religious backgrounds are no longer available with the families or those who are left behind. And in fact, it becomes very difficult for young people, especially children who have lost their parents or adolescents who have lost their parents. In fact, the loss of a parent is difficult to process for anyone. And as rightly put by Colin Murray, that grief is the price that we pay for love. And so it's a rupture of a relationship. It's just not the loss of a death or a loss or a death of a close one, but it's a rupture of a relationship. So that is how it affects individuals.
Yeah. And again, because you mentioned that, it's an important point that you raised, and let me get Dr. Kamaraju in this as well. Dr. Kamaraju, like Dr. Gupta was saying, for children, for adolescents, it's very different, how they perceive it and how they would have to handle it. And again, in this year specifically, we've seen so many of those cases where you've lost, one or even some cases, both your family members.
Yes, children grieve very differently compared to adults, and grieving is a very individualistic response. And grieving depends on the age of the child as well. Younger children permanency, whereas children death is have some understanding. So children grieve as per their age, and teenagers understand death much better. So the grieving is a very individualistic response, whether it comes to adults or children. And the child and the adolescent grieving and grieving in youngsters is very different, because adults can talk about it much more freely, openly. They can call their relatives, whereas younger children may not have the vocabulary to express grief in words. Whereas some of the children, their reactions could be very different. They could be completely silent about it, not talk about it. Sometimes they could throw a lot more tantrums. You might be seeing a lot more behavioral issues like irritability, anger, aggression. They may be angry at the loved one who passed away, or they may show anger on the person who is with them. So the grief is a very individualistic response, and it also depends on the nature of the child, temperament of the child, the circumstances of the child, the social support, the family unit, and how is this whole family unit grieving. So there are a lot of factors involved in the grieving process as a whole.
Yes, and I'll come back to you, in terms of how do you help children handle this grief and process it. But let me also go across to two of our other panelists who are with us. And Dr. Chaturvedi, to you, I started off with this story about, this unfortunate incident that happened in Mumbai. A lady, along with her, took, and her 7-year-old jumped from the balcony. Now, obviously, they were alone, the family far away. She was grieving. People around didn't even, realize the extent or the magnitude of what she must be going through. Now, today they're all wondering, could we have helped in times of a lockdown or a pandemic? Could we, had we known, could we have done anything to help her? Can anybody do anything in such circumstances?
Well, of course, people can always do. And as we heard the earlier panelists, and you also mentioned the importance of cultural factors, traditional factors. See, the grief is a normal reaction to any loss and any death. And, it is expected in a situation like this, as it was there, when there were earthquakes and tsunamis and various other disasters. So grief is a normal reaction. It is the abnormal grief which is a problem. An abnormal grief or a complicated grief, when the grief is very severe and causes suicidal ideas to people, or if it is very prolonged. I mean, a normal grief we expect to last at least 6 months to 1 year. So only if it is longer than that, we consider it as a prolonged grief and an abnormal grief. So also what you mentioned about the cultural thing, it's the mourning which is very important. See, in psychiatric practice, before the pandemic, we usually do not see many grief cases coming to, especially to psychiatric institutes. People know that it's a natural reaction, it's a normal reaction, it should go away. When it doesn't go away, or if it becomes very severe, or it complicates the picture and becomes a depression or a panic attack or alcoholism or a psychiatric disorder, then they start coming for that. So the mourning is something which is very helpful in our culture. It is a social response. And unfortunately, the pandemic has, cut the roots of the society. So you cannot mourn. And, people gradually try to mourn online and through virtual methods, but it is never the same. You need to go to a person, you need to hold them in their shoulders, you need to give them a hug, you need to sit and cry with them, you need to talk to them in front of you, you need to support them. All those things are missing. It's because of the nature of the pandemic, which is not there with other disasters. Whether it is earthquake or tsunami or anything else, it doesn't happen. But with this, because of this, the situation, it's not possible. So people are left alone, like the case that you mentioned. Nobody would go near them, nobody would support them. They would feel even more lonely and helpless, and wouldn't know what to do. And feeling helpless and hopeless is a very dangerous sign of a person trying to harm oneself or trying to make an attempt of suicide. So yeah, people should have done something. And like I've been saying, and in the current circumstances, social media is the new social support. So people should use the social media, people should use virtual methods and try to connect with people. Connection is very important. If they connect, they can ventilate, they can talk about their distress. A person who has gone is gone. You can't do much about it, but at least you can support them. You can provide some help to them. You can show them some way. It's also a question of time. As time would go by, people would probably come to terms with it. But all the features of a severe grief are with this pandemic. There are sudden deaths. You can't see the person who's dying if they have a COVID infection. You can't participate in the funeral services. You can't do various things which you mentioned, the rituals, and they are left with this feeling: what have I done? What will happen to the soul of this person? And so that is a guilt with which they have to live. This grief is going to be a very, very long grief. We are going to see pandemic of the effects of grief in the coming years. It will manifest not only as psychiatric disorders, but it also manifests as medical disorders. We know that the immunity comes down after any grieving situation, and they are likely to have much more of communicable diseases, other disorders, cancer. So a whole lot of things are going to happen. So it's a very sad situation. And I am with everyone. We wish we could do much more, but the circumstances, curtail our interventions. We need to find methods. We need to find methods which will go to people and be able to support them.
What can be some of those things that we can do? Dr. Desai, would you like to come in on this as well?
Sure. The first thing to do, Tanvi, as you always do, is to talk about issues of grief and the loss. In individual circumstances, in group situations, in media and in social media. The second thing to do is, like my friend Dr. Chaturvedi said, to recognize the difference between normal grief and abnormal or complicated grief. Surely, in this period, the proportion and the intensity of complicated or abnormal grief is going to be larger and more dangerous in terms of complications like suicide. How do you do that? Any significant biological sleep or appetite disturbance, gross day-to-day life issues, negative thoughts, especially suicidal thoughts, gross indicators for the person himself or herself or people picking up the possibility of a complicated grief. I would still say that with all the limitations that my friends Dr. Chaturvedi and Dr. Manushi and others mentioned of the current situation, the socio-cultural mechanisms that we have should work well at different levels. One, self-help. Second, through family and friends, even if it's on social media. Group support, and a lot of cities have now started grief survivor groups. Alternative methods. Very often we don't realize that religious and spiritual practices can actually hugely help deal with grief. Counselors, individual or group counselors. Like Dr. Chaturvedi said, some people who require psychiatric help do need to go to that. I would still underscore one more time that in the absence of many aspects of grief resolution that we currently have missing, we need to genuinely, and for public morale boosting, keep a positive view about how grief can be and should be dealt with. The cases like the one that you highlighted, unfortunately, do happen. Can we all be sensitive enough, especially in social media or telephonic conversations, to pick up those signals for possible complications? That sensitivity will have to be much higher in this situation. Let me also say that, like Dr. Kamraju said, we'll have to be very sensitive to children and adolescents' grief and their complications because they will not express in the manner that adults do. Let's face it, the first thing that children and adolescents who are orphaned require is physical needs being met with and safety needs and a sense of belongingness. In Delhi and Bombay and major cities, there are initiatives by official agencies and NGOs to look after that. We need to have a nationwide campaign to actually look at children and adolescents who have lost parents, people who have lost significant ones, and let me add, like both my friends said, the person who dies in an ICU or in a ward isolated. But let's also not forget that the survivors also have not had that satisfaction of meeting the person, paying last respects, having those tete-a-tetes. We need to look after that. But I would still look at it positively in terms of our socio-cultural strengths.
Yeah, but okay, fair enough. But so you're right, and in a lot of cases, maybe we are in that sense slightly better off because we have a stronger social setup and a support system. But even in our country, at least in many of the big cities, Dr. Amit Malik, people are increasingly becoming lonelier and living alone or with families elsewhere, very, very disconnected with even their own neighbors, very, very disconnected even from colleagues. You've now been in a work from home setup for 1.5 years. You've obviously, a lot of people have lost that, even your colleague circle, and that connection that you would otherwise share when you see each other face to face. Now, that's the tricky part, right? For those who may be not having that support system around them at all, what are their options? Are there, like it is in many other countries, special groups that they can reach out to, similar groups and people with similar situations?
So let me just start by saying that there are two particular groups within this that we don't talk about enough, right? One is, as you just described, young people who are living alone, right? So a lot of people, especially during the second wave, were not able to travel back to their hometowns, and they were stuck near their workplaces, and then either witnessed some bereavement, some death happening within the workplace, or in a family member who was away from them. And so that's the first group we don't talk about. I think the second group we don't talk about enough is the healthcare community, right? So the healthcare community itself is experiencing a lot of grief and trauma, especially in the last wave where things became very intense. I think there's another part of grief that's missing, right? So again, in those large cities, especially the cities that saw extreme rise of those peaks. So we are especially very concerned about those two groups, people who are in employment and working from. So we work with a large number of organizations. We work with over 100 employer organizations, and we've just launched a program for healthcare workers, right? So we just launched a program called Mindcare Plus, which provides free pro bono therapy to healthcare workers, right? Because we believe that as you develop a connection with your patients, the people you work with in the healthcare setting, and losing a large number of patients will have a high degree of grief and trauma that you'll experience, will have a significant psychological impact on you. I think that's the first thing to say. So let's pay attention to those contexts, the work context and the healthcare context, right? The second thing is that you asked, the question you asked is, yes, a lot of stuff is happening. Dr. Desai mentioned, especially in the larger cities, there are groups available. There's significant amount of online support available right now. And Dr. Chaturvedi was also mentioning, let's leverage that degree of online support. We provide a lot of online grief therapy right now to individuals and to organizations today. So how do we leverage what's available today, right? And Dr. Desai was quite rightly saying a number of levers, right? Our socio-cultural levers of leaning on family, friends, workforce, colleagues for support, but also following some hygiene strategies, right? It's important not to isolate ourselves when that happens, right? Plan for grief triggers. So plan for things that might trigger your negative thoughts soon after a loved one has passed away. Be open to reaching out when feeling overwhelmed. Reach out to family members, reach out to friends, reach out to more formal support when you're feeling overwhelmed, and because know that help will help. I think the confidence that we need to give people is that the help actually helps, right? And whether it's formal or informal help, and accept that grief can trigger unexpected emotions or unexpected time. It is not a linear journey. And it's very, very important to remember that it's not a linear journey. The journey is more cyclical. It comes in waves and goes in waves. And as Dr. Chaturvedi was saying, even with normal grief, can last up to 6 to 12 months. And it comes in cycles. And I say it again, talk to somebody, whether it's formally to a professional or informally to friends or relatives or colleagues. Reach out and seek support. Right now, there is a lot of support available to people to seek help from that perspective.
It's grief is cyclical and of course also not time bound. It could take 6 months to even a year or even longer, basis of it's of the individual itself on how it impacts you and how you're able to respond to it. But what would be the signs, Dr. Chaturvedi, that you need to watch out for to tell yourself, okay, now maybe it's derailing and I'm not able to process it properly, or maybe I do need some professional guidance?
Well, Tanvi, there are two other types of griefs which we haven't talked about till now. One is anticipatory grief. Anticipatory grief is, when a person we see has developed infection and has got very serious signs, has gone into the ICU or, has on a ventilator, and people start having anticipatory grief. And the second is anniversary grief reactions. So, every year on that same date or around that same date, people are going to have the same sort of feelings as they had during the grief reaction. So, the signs of a grief reaction would be like, they feel totally disillusioned, in shock, disbelief that what has happened, and have they actually lost the person, feeling a sense of presence of that person is still there, being able to feel them that they are around there. And, as, the other panelists mentioned, thinking about them all the time, dreaming about them all the time, pining for them, missing them totally, so these become so, overwhelming that they are not able to do other things. So these are things which are there. And also, I think Dr. Malik had mentioned earlier, something like what the reactions of a normal grief reaction are. First stage of shock and disbelief. Then there is anger. I think many people in the country were very, very angry with everyone. Angry with themselves for having come to this situation, angry with the government, angry with God, angry with, whosoever has given them infection. So anger has been there. And that is why you see people get angry at the medical professionals, at the hospitals and things like those. It's a manifestation of anger. I'm not justifying it, but it is an anger. And then they come to the phase of, bargaining and depression, which may last for many months till they come to the stage of acceptance. So this whole thing takes 4 months, 6 months, a year or so to come to the phase of acceptance. So one should be aware of this, and one should differentiate that this is not a depressive disorder. This is not an anxiety disorder. This is a grief. And as both Dr. Desai and Dr. Malik mentioned, it needs ventilation, it needs talking, it needs support. At least 2 ways which they have said it can be done. One is by online counseling, grief counseling, or online grief therapies, and second is by groups. And since you can't have groups in person now, we can have groups online also to be able to support them. And then see, our traditions and cultures are, very, very flexible. If you are not able to do certain things in certain way, there are enough pundits to tell you other methods by which you can overcome that. There is always a shraddha which will come, or something else that you can do, a small puja or a ceremony to to compensate for that. So one should do with what one is comfortable with. Have their soul at peace and have the soul of the person who's passed away at peace as far as possible.
Okay, some very helpful insights there on what can be done, how long it can take. Let me actually also now bring in Dr. Kamaraju. Dr. Kamaraju, and we've now raised it a couple of times on this show, but I want to talk specifically a little bit more about the youngsters, and how does anybody even in their family go about helping them process grief?
The first and the foremost thing that we need to understand is children also need grieving. because a lot of times parents think that children don't need to grieve. We shouldn't talk in front of them. We shouldn't be sad in front of them. We shouldn't be emotional in front of them. Grieving is an essential process. Grieving is healing. So unless people grieve, they can't heal. Of course, the grieving can be very unique depending on the age of the child. So it's very important for a parent to be there for the child. As all of our esteemed panelists have already mentioned, the uh, importance of an adult in order to take support and use all methods to go through the process of healing and grieving. So same thing with children. So if you want to take care of your child, the adult needs to take care of themselves first, because the children are under the care of parents. So whether it is parents, grandparents, or child caretakers, so they need to take care of themselves first. So they need to be self-aware, and they also need to make sure that they're going through this grieving process gradually, because it's not an overnight phenomenon. And if the parent or the caretaker is excessively emotional and very unstable, it can be detrimental to the children in the house, because a young child is only looking towards the parent. Young children need to be cared for, maybe a lot more cared for during this process. If you look at the recent data from Lancet as of 2020, it says even above children above the age of 2 are able to kind of get some kind of an understanding around the environment. There's something not usual in the environment. A lot of times we think that children below 4 may not understand anything, but they can sense that this is unusual thing in the house going on. So adults need to take care of themselves. They need to look out for children. They need to observe the children. They need to go a little easier on the behavioral issues, because the children can express it in the form of irritability, anger, sleep problems. They may be much more be clingy, not eating. So look out for those symptoms and reassure them. And usually children ask the parents, "Oh, are you going to die?" Younger children would ask, "Mama, are you going to die?" So tell them that you'll be there for them. See, answers need to be given in a very simple, short format, honest and simple, in a language appropriate to the developmental age of the child. So they need to know they would be cared for. Someone will be there with them. They will not be left alone. These reassurances help children. And the other thing that parents need to do is to help the child vocalize it. There are children, when children ask questions, do not dismiss their questions. Let the child express the feelings. Children can also express in different ways. They can write stories, they can write poems, they can draw pictures, and children can make small videos. They can do a craft work. So this is all an expression of missing the loved one, and this is a process of grieving. So set some time aside, even if the adult is busy doing the paperwork, doing all other things. It's very important to sit with the child and not overlook this process in children. In teenagers, sometimes what happens is they do not want to talk to the parent. They would want to talk to a third person. So sometimes they can talk with their peers. There are online group chats that peer support is available. Teenagers from the school form mini units, group chats, where they're able to express their grief. And there's also shared grief among children. They're sitting in homes for the last 1.5 years. They're missing school. They're missing their teachers. So for children who are not opening up at home, or who would want to talk to someone else, the teachers can talk. There are schools have pitched in as well, and some NGOs are available for children, and some parent help groups also are available online, where they're engaging children as well. So we need to understand that children also take time. We need to give them adequate support. But as I said, more importantly, be there for children. Children also take time, and also, if needed, additional support also may be required for children. Let's say, so there are immediate needs, intermediate needs, and long-term needs. Immediate needs, if a child is not at all sleeping, and it is unmanageable for a parent, definitely they need to seek the help of a counselor or a psychiatrist. And the intermediate problems is the child might look okay at the beginning, but then over the months, you could see a lot more behavioral problems emerging. So parent needs to take care of that. And the long-term problems, as all other panelists have already mentioned, we need to take care of them gradually. So this is requiring help at all levels, help from a state government level, help from the child welfare committee, help at a district level with the district to ask for help from the NGOs, help from the civilians, because this is a pandemic which is unprecedented. This is requiring support from all angles, in addition to crisis intervention centers and child helplines. So it requires a significant amount of people in order to go through this process.
Okay, let me take this, a step forward. And you mentioned how to deal with, and how to support and help children. What about those who, the family members who will have to offer this help and are also probably going through grief themselves? Dr. Gupta, would you like to comment on that? It's often the parent. I mean, if you've lost one of the parent, the other one is also grieving. They will have to take care of that themselves and then their child, which makes it even harder.
Yes, as you rightly said, it's a very difficult situation for any parent to actually grieve the loss of a partner and actually take care of the child. So there are certain things and certain guidelines which are recommended for how to behave or in front of the child, or how to actually break the news to the child. That is very important first step. It should be done as soon as possible. And as Dr. Kamaraju has said, clear communication is the key. So children do not take very well to euphemisms or complicated terms that we adults use, like your mother has passed away, or she has gone to sleep, or has gone and she's in the sky above watching over you. So it should be in a very literal language and clearly communicated to the child. If you are a parent and communicating this to your child, of course, you would be grieving and you would be tearful, and that sort of response is natural and should not be avoided. But if a person who is showing unnatural emotional reactions and is not able to control his or her emotions and showing abnormal reactions, then definitely a person close to the child, another person close to the child, should communicate that news. Also, the child needs to be reassured. Children as young as 7 years or 5 years have this tendency to believe that they are somehow responsible for their parents' death. What could they have done differently? They share an exaggerated sense of responsibility. So it's very important for the parent to actually reassure the child that he or she is not responsible in any way for causing his parents' death. That is a very important step. And establishment of a normal daily routine that the child was used to. As soon as is that possible, the child should be slowly and gradually given time to resume his normal daily activities, like going to school or playing out with friends. So these kind of activities should be resumed as soon as possible. Also, very importantly, what we see in our country and in our culture, that children are excluded from the mourning process. The rituals, the religious rituals, children are excluded from those rituals. So it's a new understanding has emerged that children should be included in that mourning process and the rituals that a family goes through. So these are certain important steps as how you can actually break that news to a child, however unfortunate the event may be.
Okay, fair enough. So that's one other aspect. I want to go back to something that was raised earlier and speak a little bit more about that. Dr. Desai, to you, we mentioned grief therapy. What does it mean, to explain it to someone who has never heard of this concept?
Sure. Let's quickly recap the 5 stages of grief for understanding grief therapy. What Dr. Chaturvedi alluded to: shock, denial, anger, bargaining, and then acceptance. Now, obviously, in this current situation, those stages are going to be more prolonged. And so in grief therapy, the counselor or the therapist will have to recognize at what stage are you finding the person first. And so your grief therapy will have to walk through that stage of resolution. In group therapy, what happens is there is a leveling off in that group situation of different people at different stages. And so people in the group learn from each other to possibly skip and bypass a few stages. 2, grief work would mean that for those persons who by personality or by circumstances are more bottling up and not expressive, you will have to find external stimuli for expression. Grief expression is, in fact, one of the very important stages of going through the anger and the bargaining to come to acceptance. Most important, one will have to recognize that while we are dealing with a huge group situation, like it was said at the outset, grieving is a very individualistic process. And so how would we be innovative in trying to help masses, large numbers, possibly in group, and yet respect those individual differences? Let me also flag this. What we are overlooking here is, as Dr. Malik said, the healthcare workers, two, the elderly. We already know that in all cultures, especially in our culture, elder person having lost a younger one, a son or a grandson or a daughter-in-law, is that much more difficult. And we might actually make the mistake of believing that the elders are used to the grieving process. Let's not make that mistake. Children and elders as adults are prone to that complication of suicide behavior or other physical complications. I must say here that while I agree with Dr. Chaturvedi that even abnormal or complicated grief is not depression, it must be differentiated, I'm sure he'll agree that in quite a few cases, it is people with pre-existing depression or recurrent depressive disorder or bipolar disorder who at the time of grief might actually have a trigger of the old illness. And so the clinicians and here even the society, we need to recognize that for those who were already going through pre-existing mental health problems or were on treatment, need to be perhaps supported that much more during grief process. Let me at the end say one more thing. I do believe that one of the best ways of helping oneself is to help others. And that's where our socio-cultural mechanisms are still very strong. A lot of people, by helping others in small or big ways, actually help oneself. And that's the biggest benefit of group process. You see, in a group process, in technical terms, it is both interpersonal learning input and interpersonal learning output. What I share with others may benefit me, may benefit others, but I indirectly pick up from what others share. And so I would still talk about constructive channelization of the guilt either on one's own or with somebody's help or with counselor's help.
Okay, interesting, way of looking at it and handling it as well. But now, we've had these series of conversations. Many of you have been on some of these discussions earlier today. And I feel that some part of what we do talk, Dr. Chaturvedi, is also, what would be applicable in regular times, to still be able to talk or to still be able to get that physical support or emotional support, or even for those who must help and reach out. A lot of it would be easier if by now we were back to living normal lives, but we are not. We are, even today, many of the states that had begun to open up and are now looking back at bringing in the curbs as the new variant now becomes a big question mark for us. So if you're not able to get out and meet people and socialize or even reach out to your loved one, if you're not able to still travel back to your home and even get that, very basic closure, then what do we do?
Well, we have to look at other novel methods. And, one I can, two are not very novel after the pandemic, which, some of the panelists have mentioned, that it is the online therapies, online counseling, and not only that, online group counseling. But one I would think of is, when we look at some of the, important deaths happened globally, is to have, some place where there is a site or a blog where people could come and, put their words or sympathies or, their support, or, even they can put virtual flowers and things like those. It is to show to the person who has lost someone that there are people with them, and that they still have people who haven't forgotten them, and that their support is already there. I wish we had a national mourning day. Like at the beginning of the pandemic, we played that ghanti and the thali and all. This has been a national calamity. It's been a death in thousands and thousands of people. And as Dr. Malik said, for every person, at least minimum 10 people have been affected, if not more. So it has affected almost every family. I don't know of any family where the death has not happened, or in my relatives, or in my neighborhood, or my friends, or doctors, and things like those. So this required national mourning to show to people that they are not been forgotten. They are still there with them, and that give them chance. Even the media, sometimes you have a small ribbon going through at the bottom of the screen where you can invite people to put in their condolences for I'm not talking about celebrities, but for normal people who had unfortunately got infection and then met their end or death, and then so that they people feel that I am doing something, and people feel that others are doing something for them, and that is what is going to make them a little more confident. A person who has gone can never be brought back. He will always be missed all their lives, but it is the support which is going to help them to carry on with their lives, and maybe to look after the other surviving family members, and to get over this survivor guilt which they will have. Could I have done something extra? Could I have done something more? What did I not do? Why me? Why my family member? This thought is going to be there with them for many, many days, many, many months, and many, many years. And so they need support. All that they need is support from their society, from the country, from their colleagues, friends, even strangers. And that is what probably might help them. I'm saying it might help them because I think that is what is would show the integrity as well as compassion of the country.
Yeah.
That is what is lacking, is compassion, which has been conspicuous by its absence.
Well, let's say it cannot harm anyone. And so in tough times like this, we should just go ahead and take an extra effort to show that empathy, to show that compassion to anyone, even if it is, people that we don't know crossing our paths at some point. You used a very interesting phrase, and I wanted to talk about that next any which ways, and which is the survivor's guilt. Dr. Amit Malik, would you want to come in on this and add more to this? What is the survivor's guilt? And, are we seeing a lot more of that, especially in cases where you've lost more than one family member? We have instances where 2, 3, 4 of the, same family people have been lost within a span of a few weeks.
It's a very, very important question, actually. And unfortunately, we have been seeing a number of people in the last couple of months where more than one person in the family has passed away, right? Which is quite natural given the nature of the infection, and the impact of that on the individual who's left behind. The psychological, the psychosocial, the financial impact is profound. But especially in this current context, where you might have also been infected, but then survived, there is a compounding of survivor's guilt that our therapists are now seeing, right? So actually helping people work through that scenario where they have taken a degree of sort of enhanced responsibility for the outcome that their loved ones suffered when they didn't suffer the similar adverse outcome is what survivor guilt is really in some ways, right? And then that complicates grief. That can definitely complicate and impact your more sort of natural reactions to grief, and just something that needs to be worked through in its own, right? The guilt that comes with it, right? The that why not me? Why did I survive? And we're actually seeing a number of cases, right? Where in one instance the mother-in-law and the husband have passed away, and the wife has survived with 2 young children, right? In one instance, we've had two parents pass away, and a young adult has survived, and I can count a number of these cases that we're currently seeing with the survivor's guilt from that perspective, and there people can experience survivor's guilt that can further complicate grief. I think it's very, very important to forgive yourself, right? In managing your thoughts, in managing the negative thoughts that can overwhelm you from time to time, especially when grief triggers happen, right? It's important to forgive yourself. I think our cultural context in which these rituals have been created, right? I would reiterate that. I think number of experienced panelists have talked about this already. Dr. Chaturvedi has, Dr. Desai has. Really falling back on the rituals in a novel way is very, very important to get that support. And because otherwise you can feel very isolated, especially if there have been multiple bereavements in the family. Right? If you think about it, not one, but maybe 2 or 3 support mechanisms have been lost at the same time. It's very, very important then to rely on wider psychosocial support, rely on friends and family. I think I go back to a very important point because I do want to raise it and talk about it a bit more, is that in the healthcare community, right, within healthcare workers, we are also seeing that survivor's guilt. Doctors who have been working on the front line, nurses who have been working on the front line, in the ICUs, in COVID centers, in the high risk, in the high dependency units, they have lost multiple patients, right? I've been talking to colleagues who even besides COVID itself, with complications of COVID, like mucormycosis, again seeing multiple bereavements happen one after the other. They themselves are experiencing a high degree of grief and survivor's guilt. I think it's important that we talk about this so that we can encourage those people to seek formal support. And I'd like to plug in again that we have a pro bono offering, free offering to healthcare workers, frontline healthcare workers, to come and seek support for their mental health themselves, basically.
Yes, actually, that's very important point. And Dr. Kamaraju, if you want to come in on that as well, because for the frontline healthcare workers, there is no break, even now. And for 1.5 years, they've just been at it, despite personal losses and the loss that they see all around them. And I don't think that even, a lot of the centers and hospitals themselves are looking at addressing it for their own staff.
I think this raises a very important question, because we need to support adults so that they can support children, so that they can support everyone else in the family. So all our panelists have beautifully described various methods. It's very important for adults to get back onto their feet, of course, gradually. But the one challenge that we always face is the accessibility, availability, and affordability of services. In metropolitan cities, this is a huge issue. When it comes to children, very young children, we find few specialists who are able to see young children. And here it's also important not to miss the negative aspects of the social media, because there are forwards going on regarding the pictures of children who are orphaned. That should not be done, because children also require privacy, children require respect as well. So it's very important to educate health workers. At the same time, counselors and therapists and psychiatrists who are working with children, they have their own grief. They're also dealing with their own families. And when you're dealing with a child or a teenager who's lost their own parent, it's not easy to deal with. So healthcare workers also need group therapy. They need group support systems in order to heal themselves, in order to talk about the shared grief, so that they can continue their work. And also women are overloaded in the current situation because of too many issues. And as other panelists said, financial issues, all kinds of problems are coming to them, and childcare is becoming extremely difficult. And the other thing with children is the socio-economic divide. Not all children have the accessibility of social media support. So we can't equate urban children to rural children. So they are requiring different support systems. So we need to also make sure that mental health is accessible and available. So this requires supporting the healthcare force and training more individuals as well. So yes, in that sense, supporting healthcare force and gaining support on an ongoing basis till we settle all of these issues is essential, not as an immediate response. We need to think of a long-term plan. Just announcing schemes to children in and itself is not enough. We need to make sure the surviving parent gets a smooth, an easier way to get the documents. Give them additional support as well.
Right.
So we need to think of children's physical health, mental health, educational plan. Look at this in a holistic manner.
No, you're absolutely right. Announcing it on paper is not going to help if you're not able to implement and give a holistic support system there as well. Completely out of time, but thank you to all of you for joining us on this conversation. I think it's been extremely insightful. I hope it is helpful to some of you who are watching. And here is a very basic, simple message. It's been a grueling, nightmarish few months for a large percentage of people in this country. So it is our responsibility as well to try and help those around us as much as we can. It is our responsibility to spread awareness about what are your options, what you may be going through, how can you deal with it, what should you do in certain circumstances, when do you reach out for professional help, what kind of help can you get. And as an individual who may not be going through any pain or grief, what can you do to help those around you? This is an extremely big part, an extremely crucial fallout of the second wave of the pandemic that we've seen. Let's not ignore it as if nothing has happened. As much as our physical health is important, so is our mental health. As much of loss that we've seen and reported all around us, grieving and mourning is part of that process for us to be able to move on. Let's try and help each other in doing that as well. Thank you for joining us.